clinical features of osteoporosis. Until the past 10 years or so, osteoporosis was not diagnosed until it became clinically apparent because of a compression fracture of a vertebral body or fracture of the wrist, hip, pelvis, or humerus. Now, in industrialized nations, it is more likely that a patient will be diagnosed with osteopenia, which is decreased bone mineral density, or BMD, on the basis of an abnormal dual energy X-ray absorptiometric or DEXA scan of the lumbar spine or proximal femur. So remember that osteopenia is decreased BMD, which is right before you would start to see osteoporosis in a more advanced case. In assessing bone density, it has been fairly well documented that for every one standard deviation below a 35-year-old normal value on a DEXA scan, defined as a T-score, the risk of incurring a fracture increases by nearly 50%. The T-score refers to the number of standard deviations by which a patient's bone density differs from the bone density of individuals of the same gender and ethnicity. And a computer-based predictive system called FRAX that can be used to determine the patient's 10-year fracture risk has been developed and is available online. Determining the serum 25-hydroxyvitamin D is worthwhile, especially for individuals living in northern latitudes, because vitamin D deficiency is common in the elderly and can be treated with oral vitamin D supplementation.